Good afternoon, everybody, or good morning, almost afternoon. Super excited to be here because we have such a special guest. I am so excited to have you meet G. She's a relatively new friend that I've made over the last little bit, and she's going to be talking to us a little bit about her tongue-tied journey and release. I think it's so cool that she sells some of the things that I recommend, and she's going through this whole process as well. So cool. How are you?
Giselle, I'm good, and you?
I am doing great. Thank you so much for meeting me.
It's been just several weeks since we saw each other, right?
That's right. I was just saying that we're kind of new friends. We've been sort of business associates for some time, and we finally got to meet up, and it's been so great. The timing's been great for both of us, and I look forward to growing old together.
Twice. Well, thanks for inviting me.
Oh, well, thank you for coming. It's a pleasure. How are you feeling?
I'm actually much better. I got my surgery last Monday, so it's been a week, and I'm feeling a whole lot better than last week for sure.
That's amazing. So, um, I was just saying that it's kind of neat for me that, I've been recommending your products with babies who have had tongue ties, and then you kind of contacted me and said, guess what? I need a tongue tie. So I'm just so happy to be able to have an adult sort of share this journey, but then even more so, you are the one that created these toys, and now you have sort of this firsthand experience of what they're feeling. And I think a lot of parents ask me all the time, does it hurt? What, just so many questions. And so that's why I wanted to do this today, to sort of dig a little bit into how the preparations went, what you did, and all those kinds of things. So yeah, just I'm going to sort of let you talk through and share your story.
Of course, I'm very happy to be sharing my story with everyone because I honestly didn't know that I had tongue tie until and it all started because I've been suffering from TMJ for a long time, and it was getting worse and worse. And I found this tongue tie release specialist who's a chiropractor. She specializes in craniofacial. And I happened to meet her, and she identified me immediately. And all my life, I had no idea I had tongue tied because I never had any kind of restrictions. I was able to speak just fine. No issues whatsoever. So I was really surprised because even my dentist could not identify. So I found out that only specialists can identify the low to mid grade tongue tie nowadays because it's very specialized field. Not everybody is trained to identify it. So that just like completely surprised me. And what a coincidence, right? Because we've been making our tears for a long time. And one of the reasons why I got to know you more deeper is because of this whole teether that you've been using in your practice. And so it was a very interesting journey in the last 4 or 5 months because I was able to relearn what you've been telling, but now from my perspective of healing my issues. So it's been very interesting.
That's so cool. Yeah. So tell me, I mean, I love the fact that you did a little bit of therapy before, because that's sort of what I always advocate, to make sure that you're nice and strong and that you work out as much of that tension and tightness that you can in preparation. I have a strong belief that doing therapy and moving allows the release to be full and complete, and even for the dentist or whoever's doing the release to sort of see and visualize exactly what they're doing.
Mm-hmm.
And then I think that the healing comes much quicker after. But of course, that's all in theory, what I think and believe. But I would love to hear sort of how much therapy you did, how often you were going, and then how you feel like it helped you.
So absolutely, I think physical therapy is absolute necessity. Um, Had I not met you and worked with you prior to this journey, I don't know if I would have thought that physical therapy would be um, necessary, to be quite honest. But as I was working with you and I was learning through your contents, I was more aware of, what it is. So when I went to see my doctor for the first time, and she told me that the whole entire process to get prepared for the surgery would take about 3 to 4 months, I was not surprised. It was a little longer than I anticipated it would be because I was ready to feel better because at that time I was under a lot of pain. But she said I needed that pre-op exercises so that the procedure can be more successful. I just took her word for it. I didn't even question. But even during the process, sometimes I'm like, is this really necessary? Because I was doing like week by week, exercises were slightly different. And it was more progressive. And when I realized that my tongue was actually doing different things that I never thought that it could, that's when I realized, maybe this is what I was talking about all this time. And surprisingly, I did have my pain was not just in the upper neck, face area. It actually traveled all the way down to my inner feet. So you know how you talk about the muscle being connected all the way from your top to the bottom area? Absolutely true. And I had really no idea that it was all from this, that I was feeling pain throughout my body. But it was very progressive and very gradual process. So I didn't recognize it immediately. But as my TMJ pain got really bad over the last few months, that's when my whole body felt like it was on fire. So during the pre-op exercises, I did feel much better. It got to a point where I was actually starting to have restricted speech and hard to swallow at times because I was just really flamed up everywhere.
Wow.
So I never had this problem until I started clenching a lot at night, and it just intensified all my muscles to tighten up everywhere. And that's when I think my tongue tie helped my muscles to be in pain even further because I was restricted. So my cheeks were doing more exercise, like more work, whereas it's not supposed to be. But whenever I was speaking and talking and eating, all these muscles that were not supposed to work were doing the extra work because my tongue tie was there. So it was very interesting to learn everything from my specialist. As she was getting me prepared for the pre-op, she explained a lot to me. And so I was able to absorb a lot and be prepared. And that's when I realized pre-op exercise is absolutely necessary. The last 1 or 2 weeks, she actually did a different exercises for me to be prepared for the operation. And the last week into the operation, prior to that, I was doing a lot of exercises. I actually recorded myself so that I can just practice a lot because she warned me if I were to not exercise prior to the surgery, I'm going to bleed a lot. And I didn't want to do that. I needed to recover fast because I have to come back to work. And so I just really exercised hard. And during the procedure, I hardly bled. And so both the oral surgeon and my therapist were very happy, and they could tell, they said, whether you've been practicing a lot or not. So I think going through physical therapy is absolutely so important for surgery, for sure.
Well, I'm not surprised that you were an A student.
Not really. I crash. I prepare last minute, but I work hard last minute.
Tell me, was the procedure sort of as you expected? Were there any sort of unexpected challenges that you faced? Were you afraid?
I was a little afraid, to be honest, because clipping my tongue just didn't sound right. But she assured me that everything will be okay, and they used scissors and Q-tips to release. So it wasn't like, getting rid of everything. It's just partial opening, making the opening available for the oral surgeon to go in with Q-tips and release the muscles. She thought she was done after about 10 minutes into the surgery, but my specialist was there with her. And she asked her to do a little more on the lower side of my tongue. So the whole procedure lasted about 20 minutes. And then in total, about 30 minutes, including sedation and all
Were
that.
you awake?
I was able to feel, but numbed enough not to feel the pain, but I was able to hear and, yes, see what was going on.
Oh, okay. And did you notice any like immediate changes in your ability to, I don't know, speak, eat, breathe? I mean, I don't know how, I always wonder how it's going to be. I always tell families the first 24 hours are sort of the roughest, and then after it should start to improve. Some kids, I mean, the number one side effect is that they actually get a little bit worse. So I would love to hear your perspective on sort of how that felt.
So as she was releasing my tongue tie, I felt the instant release, especially around my neck area. So she was working on my left side of my tongue, I felt the release on my left neck. If she was working on my right side, I felt the release on my right neck. After the procedure that evening, I actually started to feel more release throughout my body, including my inner thighs and my feet. It was just the most amazing feel. I think partially it has something to do with the medication that I was on. So I thought, okay, first day I'm like, okay, this is kind of, maybe this is unusual, maybe because of the medication, but I waited out enough. And surprisingly, because my pre-op exercises, I didn't have to take pain medication after that first few hours. And so in the evening when I texted you, remember I DM'd you, I'm like, Giselle, I feel different. At that time, I was not on any kind of painkiller and I felt more relaxed as hours went by. So my body felt greater, like really great in the next like 2 to 3 days after the surgery. The only discomfort that I had was in the mouth because I had some swelling in the tongue, which is very usual into 2 to 3 days. So I had like really fat tongue, but now it's calmed down. I still have a little bit of swelling, which is why I have a little bit trouble talking right now. But in terms of positioning of my tongue, the way it's resting in my mouth, it's absolutely different. It's actually resting, yeah, when I point out my tongue, it's not making that heart shape anymore. It's actually full tongue coming out.
That's so cool. Where's your tongue right now when you're just sort of at rest?
It's it's covering the entire roof of my mouth, which is what it's supposed to do. Before I learned about all this, it was just kind of curled up, in my opinion. Like I think if I think back, I think it was curled up all the time. And as I was doing more exercises, that's when she practiced my tongue. Well, that's when I practiced my tongue to rest on. Yeah, I tried to let it rest on top of my tongue. Yeah, so I did a lot of caves, which helped me like lift a lot of blood vessels, which minimize the bleeding during the procedure. So when you don't bleed a lot during the procedure, it helps oral surgeons to get in deeper and do a better job with their operations. If you bleed a lot, they can't see, so the procedure may not go as well. Then I heard that you can actually end up with other kind of problems. So, yeah, another reason why pre-op exercise is super important.
It's also really cool, fascinating to me that you were able to go in with your specialist that was able to sort of, they worked hand in hand to make sure, because she knows sort of where you struggle and like just from your functional issues, like where, you may need to focus and center. I think that's really neat.
Yes, she was absolutely amazing, very supportive. And the oral surgeon is actually located one building next to her, which makes it easy for both of them to work together. But I think it's like a teamwork. for the best outcome.
That's really neat. I'm going to open the floor to anyone who may have some questions. But while they're writing, I just have another question. Did you have any like specific instructions that you had to follow after the procedure? Any exercises like we give to the children?
Oh, yes. So I was given an exercise routine for post-operation. First week was different. This week I have a new set of exercises as well. So it's more progressive as you're healing and starting to feel better. But she said it's very important that I continue to exercise it even if I don't feel like exercising at all. Yeah. And
Yeah.
give like, some antibacterial mouthwash and gel to help with inflammation. And I was told to keep my mouth super clean. I was on liquid diet almost just because I don't feel like chewing, and I couldn't really open my mouth very wide because I was very swelled up. So eating food is because, it was kind of very uncomfortable to do, to be quite honest. So it was more liquid, more soft diet, no straws, just very slow eating process.
Hmm. Okay, that's really interesting to know, because I think a lot of kids cry when it's time for feeding, and then parents get paranoid, like, what have we done? Did we do the right thing? How long would you say that discomfort lasted?
I would say about 3 to 4 days. About third day was like really heightened because my swelling was intensified. So I was really scared because typically after surgery, you're swelled up the first day and then you get better. But with tongue, it was different. They said it's going to be the second or third day when you're going to start seeing the more swelling. And I think it's partially because of the bacteria growing. I'm just trying to think of it from a more scientific way. But yes, so second or third day was most uncomfortable. But the pain wasn't that bad. And I think partially because I took Tylenol for 2 days to help out with swelling. Not
Oh,
because, yeah, and that helped.
okay, so you were taking it more for, not for pain so much.
It wasn't for pain much. It wasn't really painful. I think if you do pre-op exercises like really well, your recovery, the surgery area is not going to be very invasive. So it's not that bad. But like when you stretch your mouth, it's very uncomfortable. It's more of fear than the pain itself. But so I took really small bites when I started to chew because stretching my mouth it was kind of nerve-wracking because I didn't want to tear up my stitchers. Yeah, so it's more fear factor, not so much of a pain factor, in my opinion.
Right. Right. So it's interesting, the difference I think between adults and children is that our anatomy just happens to be much longer. Like if you compare the size of my hand to the size of an infant's hand, so much smaller. So the incision is so much smaller. And I think that the swelling and the pain is also much less than it would be in an adult because they're just not cutting through as much tissue, if that makes sense.
Yes. So my specialist, she also does a lot of tongue tie releases for babies. And she says definitely babies heal a lot faster than adults. And it's much better to have tongue tie release done when they're an infant because there's a lot less complication. There's less problematic, like less problem that's going to develop as you age. Like, with me, my TMJ really got intensified because of the tongue tie. So those are more preventative measure if you can get it done earlier. If you know that if your infant has it, I mean, always you have to follow what the expert says and what the doctors tell you, but don't question it. That's my advice.
Yeah, well, I think the problem too is that not everybody always knows, so you're not always
Yeah.
getting different opinions, and then that can be confusing for some people to know what's the right thing to do. They
Right.
may be able to identify it, but then someone else says, no, 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 that's not really a thing. It's, or you have it, but you don't have to do anything about it. So it gets confusing from all the different opinions.
Yeah, I totally agree with you. After the surgery, I actually, and before the surgery, I did a lot of research on this because I wanted to make sure that I know what I'm getting into.
Yeah.
What I found out was that there are plenty of people who are treating TMJ and they also end up getting tongue tie release because they're in the same boat as I am. But oral surgeons, some of them, they don't say you need to get the exercises done prior to the surgery, and they'll just tell you to get the surgery right away. And those people, which I read on Reddit, they ended up getting more problems after the surgery because it just didn't feel right afterwards, and the release wasn't done correctly. And so they had to get it again and again, or they just gave up. And it just overcomplicated the whole pain for them.
Yeah. Yeah.
People who went through pre operation exercises like I did, they had a lot more success and they were able to relax their body and their muscles are more relaxed and feel less pain, and their TMJ improved over the years. So that's hopefully that's what I'm heading
Yes.
towards.
So, and it's so interesting because that's exactly what I find in my practice. I mean, I work with infants, but the people that come for work before very seldom need a lot of work after, because I can get them to a place and then once they have the surgery, everything just kind of restores normal. But the kids that don't find me until after, they find me after because they're having issues and things haven't resolved or things have gotten worse. And then everything ends up taking a little bit longer. So it's really interesting to hear that the same thing happens in adults. And, you know, I'm not surprised because we know that with all the different body parts, with people who have like total knee replacements or ACL repairs or any of that kind of stuff, they always do better if they've done a little bit of therapy before. It helps their brain prepare, it helps their body prepare, it helps their muscles prepare. And then I feel like it's not as scary for you going in because you sort of know you've already been moving your tongue, you know what things feel like, what to expect. And to me, after can be a little bit scary, you know, when things hurt a little bit or that they're stiff. So it's so interesting to hear your perspective. Would you say, I know it's only been a week, but would you say that the procedure improved the issues you were experiencing?
Initially, it definitely did. Right now, I'm about 1 week into the surgery, and I haven't been very good with my exercises. So, and then I came back to work, so my neck area is starting to tense up a little more. So I started doing more exercises, and you know, I'm working on releasing my body again. But absolutely, it did help, and right now, just I can feel the way my tongue is resting and the posture itself. I'm not having my face forward so much because I found out that, you know, when I'm working, my face is always coming forward. And I heard that's partially because of the restrictions that I have with the muscles being so tight. And so my overall body, it feels more freed up. And especially when I go to exercise or do my yoga, I do feel a lot better movement than I did before. So absolutely, it did help.
So interesting. So you have felt some like changes in just like your overall comfort.
Mm.
That DM that you sent me that first night when we were talking back and forth, you told me that you felt a release in the bottom of your feet, and I thought that was so neat.
It was because I could never tell what that was, you know. But then there was that one live that you did for us that talked about the whole tongue muscle going down through your body,
Gosh.
through the inner thighs and to the feet. So that whole lineup in my body is where I feel the most tension. So prior to the surgery, like I had to roll. Like I do a lot of foam rolling and ball rolling to release my tension. Um, it was just so tight that I was in so much pain. But after the surgery, it's actually a lot more fluid. So
Wow.
Yeah, when I roll, it releases faster for sure. Because before it used to take me like an hour to go through the entire body. Now it's more like 30 minutes and I would feel more release.
That's really neat. Now, tell me about any like follow-up appointments or like recommended exercises for recovery. What's that like for an adult?
Um, so I need to go in once a week, at least. But once a week is recommended right now, and she's giving me weekly exercises. So I went last week right after the surgery so she can check on my incision area. And she looked at my tongue area and she said the surgery went really well. The release was really done well. And she said it was because I was practicing a lot prior to, which caused less bleeding
Yeah.
and is actually the result of the success of the surgery. So as long as you found the right practitioner, like who can really help you through the whole
Mm.
process, um, I think finding that person is the key because, like you said, some they have like different opinions, different practices. But Katie, the one that I found, she was absolutely amazing, and she also had a neurosurgeon. She was also really good at doing what she's doing. So it's just like I say do your research and do a lot of exercises and help your baby feel better, I guess.
Yeah, well, I love that you say that, but how would you say, based on sort of how you felt, and I know you're not an infant, but how best do you feel that like family can support you during this sort of recovery early on and then, you know?
Hmm. You know, I like speaking from my experience for myself, just resting is very important. Um, for sure, like you got to get your sleep. First day, you're going to be really exhausted. Second and third day, you're not going to want to feel like you want to talk, or drink. It's uncomfortable, So if I am feeling like that, I can't imagine how infants would feel. It's going to be very difficult for them because they cannot communicate,
Right.
right? But I think for parents, as long as you're in good hands, it's just their way of expressing their discomfort. And it's just going to last about a week, hopefully, right? And then they're going to start feeling a whole lot better. So to me, the whole process was worth it because need to find a solution for the TMJ problem that I had. And I just happened to find out that I had this, and I actually got that checked off and, ready to move on. So I'll see how that goes, but definitely get plenty of rest, less
Yeah.
interference, more calming environment. I think that's helpful.
Yeah. Love that. I love like just keep them comfortable, keep them loved and
Yeah.
supported. And I like also that you said don't encourage them to talk. So like let them rest in whatever way that means as a child, right? So not too much crying. If they're uncomfortable, we can give them things to manage that. Um, we always say a lot of like skin to skin, some like baths with them just to keep them sort of calm and help them manage their discomfort. But I also love knowing that you're giving hope that it's just a couple of days and then it passes. So we can't promise that it's pain free, but we can promise that there's an endpoint to it and it's worth the trouble.
I think the discomfort is more from the swelling because when I started to swell up, it was hard to breathe.
Wow. That's interesting to know. Yeah, I don't know that I see a lot of swelling in infants. So it's interesting. It could be that it's a little different from adults to babies, but certainly that's true. If there's a lot of swelling, it's gonna, make it difficult to breathe. I never thought about that. Excellent. Any like final thoughts or last words of encouragement?
Um, if your baby has tongue tie, well, as soon as I found out that I had tongue tie, I was ready to do the exercises. Partially because of thanks to you, Giselle, because I was more aware of it. So building that awareness, doing a lot of research to really understand what the whole process is about, and understanding why you have to do it. is going to just add more confidence. Because if your baby has tongue tie, it needs to be released. Or, in my opinion, I think it's better to be released when they're infants,
Mhm.
because an adult, it is harder and longer process to release it. So being aware of it is one thing, and then finding the right person to help through that process is another. And then doing a lot of research and just being more aware of what to expect will help you, um, get through the process better.
Awesome. There's a question that came through. Someone asked that they were wondering if you had any difficulties that you can remember as a child.
That's the thing. I never realized I had tongue tie. I never had restrictions. Um, Up until the point where I started having a lot of TMJ pain.
Mm,
Um, so it just developed recently. But when um, my muscle tightness got really worse, that's when I started feeling the restrictions with my speech. And I couldn't talk longer because um, I was just really restricted.
right. That's so interesting.
But not as young child, which is why it went unnoticed. And Katie, my specialist, my doctor, she said that there are a lot of people like me out there that they don't even realize that they have it until they're looked at by a specialist who can tell whether a person has a tongue tie or not.
Right.
And there are grades of tongue tie too.
Mhm. Exactly. That's so interesting. Thank you so much for telling your story and for coming out here. I loved your toys before I even knew who you are, and now I love them even more because I just know who stands behind them. You guys are such a wonderful company and great people and so gracious and loving. And it really comes out in your products, in the quality. And you guys actually have a big sale going on right now. So I am going to save and post this and post my extra coupon that they've given us so graciously always. Um, you could go ahead and tell them a little more.
Okay. So this week we have our teether sale going on. So it's like great value, and you can also use Giselle's coupon to get extra 15% off. Free shipping on $25 or more purchase. And there's a lot of gift going on too. Like if you purchase over certain dollars, you get like free blanket. A lot of sale going on right now.
Oh, awesome. I may have to stock up too because I do give them to every single patient that comes into our office because I just feel so strongly that these are really good and I don't want people to have to even wait for them to come to them. So I always say, here's one to start. If you like them, you could buy more.
So next week we have our BOGO sale, but before we reach our November, holiday sales, I wanted to celebrate my surgery by offering discount on our teethers, which is why we're having this sale this week.
Oh,
Yeah, because it was just like a very interesting experience. And, as I was doing my practices, my doctor, Katie, she actually goes to Home Depot and all these places to look for tools to use.
yeah.
There aren't a lot of products out there that's catered to specific needs for the practitioners,
Right.
right?
Well, that's how you guys, because I'm always searching for what I could use. And while it wasn't created for that purpose, it ends up working out so nicely.
So that's great. So now I'm more inspired because I have a personal story to tell. And I could probably feel what the baby is feeling, well, somewhat, right?
I mean,
So
I would pay money to see you using your teethers.
yeah. So, and you're interesting products now that I'm more inspired to do such to help the community. So
Amazing. Gee, thank you so much for coming on and sharing your story. I think it's been so eye-opening for me and hopefully for parents. I am going to post this on my page so that, parents can see and learn and I feel like you really gave a voice to these little babies because sometimes we wonder what they're feeling. But it's nice to know that you feel like it was worth it. And, the realities of it, that it's not a perfect thing and it takes time, but in the end, it was worth doing it.
Yes. Thanks for having me.
Thank you, and we'll be in touch. Thanks everyone for watching. Take care.